In this video, we will discuss Gilbert syndrome, a common inherited condition that causes mild elevation of bilirubin levels. Let's break it down step by step so you can understand it very clearly. First, Gilbert syndrome is the most common inherited cause of hyperbilirubinemia, meaning it leads to an increase in bilirubin levels in the blood. This condition usually becomes apparent during adolescence and follows an autosomal recessive pattern of inheritance. This means both the parents need to pass on mutated gene for the condition to manifest. Now let's talk about the root cause. Gilbert syndrome is caused by the mutation in the promoter region of UGT1A1 gene. This gene is responsible for coding an enzyme called as UDP-glucuronosyltransferase. This enzyme plays a very critical role in conjugating bilirubin, a process that makes bilirubin water soluble so it can be excreted by the liver. But in Gilbert syndrome, the mutation reduces the activity of this enzyme, leading to less efficient conjugation of bilirubin. As a result, what happens is unconjugated or direct bilirubin builds up in the blood. And additionally, there may also be impaired uptake of bilirubin by the liver. So, how does this mean clinically? Interestingly, most patients with a Gilbert syndrome are asymptomatic. However, some might experience non-specific symptoms like fatigue or a loss of appetite. The hallmark of the condition is transient mild jaundice, which occurs when indirect bilirubin levels rise. This jaundice is usually triggered by certain factors that increase bilirubin production or decrease its clearance. So these triggers, including stress such as trauma or illness, may be prolonged fasting also, or maybe sometimes in chronic alcohol consumption. So when patients of Gilbert syndrome face these situations, stressful situations, they might notice a slight yellowing of their skin or eyes. So it's important to note that this jaundice is usually mild and temporary. Now, how Gilbert syndrome is diagnosed? It is relatively straightforward. Blood tests show typically a slight increase in indirect bilirubin, usually below 3 milligrams per deciliter. The key is that liver function tests are absolutely normal and there is no evidence of hemolysis, meaning there is no excessive breakdown of red blood cells contributing to the bilirubin levels. So these findings help differentiate Gilbert syndrome from other more serious liver or blood conditions. So finally, let's address the treatment. The good news is that no treatment is required for the Gilbert syndrome. It's a benign condition, meaning it does not cause harm or lead to complications. Patients should simply be reassured about the nature of their condition and educated on avoiding triggers if they notice symptoms. So finally, to summarize, Gilbert syndrome is a common and harmless condition characterized by mild intermittent jaundice triggered by the factors like stress, fasting, or alcohol consumption. It is caused by a genetic mutation that slightly reduces the bilirubin conjugation in the liver, leading to mild increase in the indirect bilirubin. Diagnosis is mainly based upon the laboratory findings of isolated hyperbilirubinemia with normal liver function and no hemolysis. And remember, no treatment is needed, just reassurance and education, right? So this is what we need to know about all the important points regarding Gilbert syndrome.